today. One is about setting up modern and comprehensive cancer treatment center in Maiduguri, about improving the mobility for NAFDAC by approving more vehicles for them, and then other memos about bringing some specialized painkillers into make them more available for use in the country. But the most important topic of the day is the COVID-19, and those who have been watching the briefings of PTF for a long time will know that for weeks we have been talking about the imminence of COVID-19, second wave which has been going on in Europe and America, causing great embarrassment to the health system, which we have been talking about could be coming into our country, is beginning to really manifest. It is that manifestation that we all have to wake up to and buck up to confront. It is not a job for the health sector alone. It's a job for everybody, for all citizens, and for you who are here listening to us today to send the word out. First of all, what the public needs to do, to redouble their efforts to comply with all the advisories that we have been given, using your mask every time you're outside of your house. And I'm happy to see all of you here are masked today, which is the correct thing, but also encouraging others to do the same. Once you are leaving your house, put on a mask. The mask should cover your nose the way it covers your mouth. 2B, do not take your mask down to talk to somebody. You should leave your mask on, as I'm doing now. I don't need to put it down to talk to you. If you do that, you have defeated the purpose. Number 3, do wash your hands frequently. That advisory is still there, and it does not change. Number 4, use sanitizers. Number 5, the social distancing. Social distancing means keep gap between you and other people, because more than 80% of people who have COVID-19 will not have a symptom. They'll be looking very fine. But it's a very easily spread disease, spreads so fast and so easily, and that's why it's a very fearsome kind of infection, that you can easily pass it to the next person, and that person can have symptoms, the same virus with 2 different kind of manifestation in people that can kill one person and the other one is smiling. So that's what makes it a very deadly illness, the transmissibility, and the fact that those who are mostly victims are those who either have diabetes, hypertension, or any kind of disease that already was a foundation for their illness. Most of the victims are mature people over the age of 50, but it has also been seen in children. Even as children as low as 6 years old have also succumbed to COVID-19. It is not impossible. So therefore, we need to redouble our efforts. We need to spread the message around. Everybody here needs to be ambassador of and a champion of keeping to the non-pharmaceutical interventions. You should be telling people to put on their mask. Anybody comes to talk to you without a mask, don't talk to them. And we are appealing to all those who have shops, who have stores. Do not allow any person into your store unless that person is wearing a mask. And if you are a buyer, do not go and buy anywhere if the seller is not wearing a mask. Even in the market, they should be wearing a mask, because this one protects everybody. It's for mutual protection. You protect me, I protect you. And in countries where they have been able to enforce masks, the COVID-19 rate has dropped. There are theories that say that if everybody were to wear a mask over a certain number of weeks, COVID will almost disappear, because the chances for spread are not there. So therefore, that is the easiest and cheapest approach to trying to protect ourselves from infection. As for the health sector, we hope that if everybody or if most people are complying, we have less work. We have less pressure on the health system. The health system has to be ready for about 5% whose symptoms will become so serious that they have to be rushed into the hospital. Only 5%. 80% have no symptoms. 15% have some moderate symptoms, and they will know. They are isolated at home. But 5% will have very, very grievous symptoms. The numbers are so many that it is that 5% that is overwhelming health systems in other countries, in North America, in Europe. Only 5%. that need ventilators, they need respirators, they need oxygen concentrators, they need all sorts of medicines, they need drips. And those are the ones that really put pressure on the health system. We don't want to get that place, because prevention is better than cure. We want to put all efforts into prevention, at the same time prepare for the worst. We have asked all our hospitals who have isolation centers or treatment centers to reopen, and we have told all the ICUs to wake up and gear up. We have positioned materials, PPEs and so on in various places, and we have trained a lot of intensive care doctors and nurses. We are going to intensify the training so that we are ready. But we want you to help by making sure that these numbers go down, that the number of people who get infected does not continue to rise. That is a public side. It is not something the health sector alone can handle.